Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a progressive neurodegenerative disorder that affects nerve cells in the brain and spinal cord. It primarily leads to the degeneration of motor neurons, which are responsible for controlling voluntary muscle movements. The symptoms of ALS can vary from person to person and may include muscle weakness. The most common initial symptom of ALS is muscle weakness. It often starts in one limb, usually a hand or foot, and gradually spreads to other parts of the body. Weakness may cause difficulty with activities that involve fine motor skills, such as buttoning shirts or picking up objects. Muscle twitching and cramps. Many individuals with ALS experience muscle twitching, fasciculations, and cramps. These sensations are often noticeable in affected muscles and can be uncomfortable or painful. Muscle atrophy. As the disease progresses, the muscles gradually waste away, atrophy, due to the loss of motor neurons. This leads to a reduction in muscle mass, making affected limbs appear thinner. Difficulty speaking and swallowing. ALS can affect the muscles responsible for speech and swallowing. People with ALS might notice changes in their voice, slurred speech, or difficulty in swallowing both liquids and solids. Difficulty breathing. ALS can eventually impact the muscles involved in breathing, leading to shortness of breath, labored breathing, and respiratory distress. This is a serious aspect of the disease that may require medical intervention. Fatigue. People with ALS often experience significant fatigue, which can be related to the effort required to compensate for weakened muscles during everyday activities. Muscle stiffness and spasticity. In some cases, ALS can cause muscle stiffness and spasticity, which are characterized by tightness and involuntary muscle contractions. Difficulty walking. As the disease progresses, weakness and loss of coordination can make walking and maintaining balance challenging. Cognitive and behavioral changes. A small percentage of people with ALS experience changes in cognition and behavior, such as problems with decision-making, memory, and emotional regulation. This is known as frontotemporal dementia, which can occur in conjunction with ALS. It's important to note that the progression of ALS varies widely among individuals. Some may experience a slower progression of symptoms over several years, while others may experience a more rapid decline. ALS is generally diagnosed through clinical assessment, medical history, physical examination, and various tests to rule out other conditions. If you or someone you know is experiencing symptoms that might be indicative of ALS, it's crucial to seek medical attention and consultation with a neurologist for proper diagnosis and management. Did you enjoy the video? Let me know in the comments below what you thought and if there are any other topics you'd like me to cover. If you like what you are seeing, please subscribe and hit the like button. Your support helps me create more great content. Thanks for watching.